So I'd like to start and introduce just briefly our guest speaker today. It's Julie Muccini. She's an occupational therapist at Stanford University and has taught a bunch of seminars that some of you may have attended on Parkinson's disease and driving, or really the seminars have been on senior issues and driving, or just driving in general and driving rehabilitation. And she's going to be speaking today specifically about driving issues as related to Parkinson's disease, and then more generally about driving issues as we age. So take it away, Julie.
Okay, so thank you, Robin. Thank you for having me. It's always a pleasure sharing my understanding and expertise in driving. I have a tendency to speak quickly. Please slow me down, or we can review slides. I can go back at any time. So my name is Julie Muccini. I'm an occupational therapist. I worked at the Stanford Healthcare since 1996. And in March, officially April, I transitioned my job to working as the clinical research manager in the Human Performance Lab on the Stanford University side. So you can see my email is no longer stanfordhealthcare.org. But if you really need to reach me, you can reach me here at jmuccini@stanford.edu. And I am in very close contact with my colleagues in the outpatient neuro rehab clinic, which is at 213 Quarry Road here just on the edge of campus. So, there we go. So I have no relevant financial or non-financial relationships to disclose. And let us begin by discussing the goals of today's talk. So today, I would like to review the issues that may compromise driving ability for individuals with Parkinson's disease. I would like to another goal is to increase the understanding of clinic-based occupational therapy, driving evaluation, to review the California state law about Parkinson's disease and driving, and describe the DMV driver medical evaluation if you've been asked to complete one, and increase the awareness to local and national level resources. And if I haven't answered your question, there's plenty of time at the end. We can go through and answer each of your questions. So just to begin, it's, as you know, important to understand the changes that your body's experiencing and talk about motor skills. So I know we're talking about driving, but motor is not your car's motor. We refer to movement as motor functioning. And so your movement may be slower. You may have changes in your strength, but not always. I have patients who have slower movement, but they maintain quite a bit of strength. Balance can be affected. Range of motion may be diminished in your neck range of motion, your shoulders, and your trunk rotation, which of course for driving can pose a problem. You may be experiencing muscle tightness, rigidity, and tremor, which can impair your ability to react quickly to emergencies or changing traffic patterns. It's important to note, I've worked with many individuals who have significant resting tremors. And when we work on the driving simulator, it really has not affected their ability to steer and manage the gas and brake pedal. And of course, everyone's different, but I've had many cases where you're able to adjust to the tremor and manage these pedals. So I know that's always a question, just because I have a resting tremor, is that going to affect my ability to drive? And it should be evaluated on case-by-case basis. Issues that may compromise driving ability also relate to your cognitive skills, referring to one's ability to receive and process incoming information by your perception, your reasoning, your judgment skills, and your memory. Not just memory, do I remember, at a four-way stop sign, who went first, who went last, but your visual memory, which relates over to visual skills. Patients may experience changes in their visual spatial skills, so their ability to gauge the distance to a stop sign or other vehicles. I have many individuals with Parkinson's, and one thing they talk about, or their family will mention, it's just how how closely they're edging to the right side. And it seems like they're barely just skimming by the cars parked on the right, and how that's a little disconcerting. And so there's that visual spatial issue that we try to address and remediate. Difficulty maintaining a safe lane position. And so that's what we're talking about. I didn't mention here, but I do have individuals where after they take their medication in the morning, about an hour later, they'll experience fatigue. And so if that's a situation, that would be another very serious thing to consider, that you would not want to be driving if you experience that lull after you take your medication, because I do have many patients who have fallen asleep at the wheel. And of course, that is less than ideal. Okay. So what is a clinic-based occupational therapy assessment? Well, how do you see the Stanford OT for a clinic-based driving evaluation? So if you're experiencing some of those things, those symptoms I mentioned, whether it's motor, cognitive, or visual impairments, or your family's noticing some changes in your driving skills, or you've noticed that you're kind of scraping the bushes, or you're knocking into the curbs, or you're hitting little posts, these are all red flags. Might be time to come in and be assessed. Of course, the first thing is you would make an appointment with your neurologist. And in the Stanford outpatient clinic specifically, you're required to receive a referral from a Stanford physician. So a Stanford doctor has to place the referral for you to receive an OT, clinic-based driving assessment. And remember, we're in the clinic. We don't go to your home. We don't do the driving assessment in your vehicle. And then you're going to check your insurance. Some insurances won't cover the driving assessment. And then you would schedule an appointment in the outpatient neuro clinic. For us, it's at 213 Quarry Road. There are other outpatient neuro clinics. So if you don't happen to be a patient with Stanford, you could check to see if the OTs in their clinic will offer a clinic-based driving evaluation. I think I heard that some other local clinics might be getting simulators, so that's good news. So here's our simulator. So this is a picture of me sitting in our STI SIM as the manufacturer of this driving simulator. So you can see it's got these three large screens, and it has a steering wheel, and we've got three pedals. The one on the left we don't use, but there's a gas pedal and a brake pedal, and the seat is adjustable, and there is a seat belt. So it's a pretty basic setup, but again, it's not like your car. And if anyone has ever been to our clinic and experienced the driving evaluation, the first thing I've been told, and I've heard it probably 1,000 times, this is not like my vehicle, and I completely agree. But we are looking at certain skills, and that will help us help you understand where you have issues, whether it's related to reaction times or visual processing or divided attention issues. So basically the outpatient neuro rehab clinic driving assessment, and here's the link to our web page, is it may take 1 to 3 visits to complete the assessment. And just, it's important to remember, the occupational therapist, we are not the DMV. So, the therapist will provide your feedback, will provide the feedback to you on how you do on all your tests, and then we put it in the chart, and the physician will review them with you. We review them with you. The physician reviews them with you. If you're really a hazard, we'll tell you, and the doctor can put in a note to the DMV. Worst case scenario, we could, but we really discuss this carefully with you before any of contact is made with the DMV. So I think it's important to say that. That you'll be assessed with the following, but not all of these tests. We have visual processing called the USO field of view, which measures your central vision, your peripheral vision, and divided attention, which those visual processing skills are really key for driving. We have this driving simulator. We have a paper and pencil Rookwood driving battery assessment. So we do have a paper and pencil assessment that assesses all the areas of divided attention, executive functioning skills, a whole range of assessments, simple assessments, but critical for driving. And that's when the driving simulator is difficult for you or promotes a sensation of nausea, or if you feel nauseated, then we would rather do a paper and pencil assessment. We have other large touchscreens that also help us identify your divided attention skills and visual processing. And if you're not reaching or looking, scanning properly, we can identify that and help you remediate some of those skills potentially. We do manual motor muscle assessments. And the Snell and visual acuity, which I'll talk about that in more detail. So what does the California DMV say? So I'm just good. This is, it's in italics. I took it right off their website, and here's the link to their site. And I will provide all of these slides to Robin if she wants to share them. I am happy to share all of this with all of you. Let me just move your little screen over here so I can read it. But essentially, certain medical conditions can affect your ability to drive safely, but having a medical condition does not mean that your driving privileges will be restricted. Whether you have an illness, injury, or you take medication that causes certain side effects. If you are diagnosed with a medical condition that may affect your driving, you should let the Department of Motor Vehicles know. So if you do get a new diagnosis of Parkinson's disease or a host of other diagnoses, you can let the DMV know, because then they have the right to reassess you, whether it's on the learning test, the knowledge test, that's the paper and pencil test, or the actual on the road assessment. They do have the right to reassess you. But most people don't let the DMV know when they get a new diagnosis. It's just what happens. People don't know to tell the DMV. You can learn more about specific medical conditions and how they can affect your driving and what kind of information the DMV uses to evaluate your driving privileges. So just so you know, so someone raised their hand. I don't know, Robin, do you want me to answer questions now or go through? I only have 18 slides. So
yeah, when I see a question that is applicable, I'll interrupt you, but we can save the rest of the questions to the end.
At the end? Okay, sounds good.
Yeah.
Okay. So some of the medical conditions that is really important for the DMV, and they will notify you to come in for reassessment, is a diagnosis of dementia. And there's a range of dementia, diabetes, because you could go into a diabetic coma, and that would cause you to, that would impair your ability to drive. Any diagnosis of lapses of consciousness, like narcolepsy, where you just fall asleep without warning. And of course, visual conditions where you have blindness associated for many different diagnoses can cause visual impairments, including post-stroke. So these are diagnoses that the DMV really would like you to come back and they'd like to reassess you. What qualifications does the DMV use to investigate or re-examine drivers? So I just put this up. This is just a screenshot off the website because they have spent the past year, I would say the past 1 to 2 years, the DMV has completely revised and updated their website. And I hadn't gone through 2 of these tabs, but I know the physical, sensory, and mental requirements, medical and emotional requirements, physical and mental condition. Compensating factors is really, so if you have a physical disability and you're using an adaptive vehicle, whether it's adaptive steering wheel or adaptive seats or anything adapted, you would have to go back and be reevaluated. So if you added mirrors or if you added something to affect how your car drives, you would need to be reassessed and they would stamp it on your license. Basic driving understanding and awareness. Do you understand the rules of the road? Decision options. This tab I didn't explore more deeply, so I don't know what that is. And of course, hearing impairments. You can drive with a hearing impairment, but they want to be sure that you have the right notifications in your vehicle so that you can identify what's happening on the road. So if, let's say, you are going back or you're coming back in for some type of a reassessment, even if it's to redo your knowledge test, at a certain age, they'll have you come back in and redo your knowledge test. No matter what, you're going to have to go through this vision assessment. The minimum is a 20/40 visual acuity. And basically that's for both eyes together and for each eye separately while both eyes remain open. But generally when you show up, they'll have you either with your glasses or without. But if you do it with your glasses, if you take that visual test, you have to take your picture with your glasses on. And it looks like that. So when you go to the DMV, you see these letters in 5 rows behind the cashier's head. So basically they're giving you 5 rows or 4 rows of this acuity, which is 20/40, and they'll say, okay, read line C, or okay, read line A. So be sure, if you ever have to go to the DMV for any reason, make sure you've gone to the optometrist, your prescription's accurate, because even if you have all the paperwork and everything's in line, if you don't pass this visual acuity test, then you can't even pass you can't continue on. That's it for the day. So I've had some patients come back and they were really disappointed because they just hadn't updated their prescriptions. Okay, so I know I'm jumping around and we'll go back and answer questions, but if, let's say, you have been told that you have your license has been suspended, or you have issues due to some medical situation, and you've been asked to complete a driver medical evaluation, I just want you to know that this is what it looks like. This is the first page of 5 pages, and I'm only showing you the first page, but I do have some patients who were told that for various symptoms that their license was being suspended, and that they would have to either remediate skills or whether take medications to help manage some of the symptoms. And this is the medical evaluation form that they're being asked to complete. So basically you would fill out page 1. So you would complete sections 1, 2, and 3. And then you're going to take that form to the medical professional who is the most familiar with your health history. So it may or may not be your primary care physician. It may most likely, if you've been diagnosed with Parkinson's, it's your neurologist, and you're going to, or your physical medicine and rehab doctor, it depends. But you're going to ask that physician to complete the remaining 4 pages. And they don't have to give a lot of detail. Basically, they could say, they're under my care. They've been started on their Cinemet. They've had remediation with occupational therapy. We feel like you should give them a second chance, kind of thing. And then once all that paperwork's been submitted to the Department of Motor Vehicles, you would be asked to go in and have a hearing with the driving safety officer. And so you can say, yes, I was pulled over. They pulled my license. But now I'm under the care of a neurologist. I'm taking the appropriate medications. I've worked with therapy. I've remediated my skills. I'd like to be reconsidered for this, for a license again. And then what would happen is the driving safety officer would hear your case, and you're on your own. You'd no family member, no one's allowed in there with you. You really have to be able to have this conversation independently, and they record the conversation. Then they will say, okay, that's fine. Sometimes they'll say, why don't you take the learning test now? Or sometimes they'll say, why don't you study the book and come back? Or they'll say, oh, you don't have to take the knowledge test. Why don't we sign you up for the on-the-road reassessment? Sometimes if you're lucky, you'll get a spot in a day or so, but it's like a couple of weeks later, will you reschedule, and you will have the opportunity to work with to take the test again, actually driving around the neighborhood. And I didn't put it on the slide, but I'd like to say, if ever you have to do a driving assessment with the DMV, the test for the adults is different than the test for the 16-year-olds getting their license for the first time. The test for the adults is more difficult. They will drive you around the neighborhood. And I've heard my patients come back and have said, we were driven around the neighborhood and then we were told to remember how to get back to the DMV. That's one. The other thing is sometimes if the DMV is located next to a freeway, they will have you go on, merge onto the highway, accelerate up to the appropriate speed, and get off at the next freeway, the highway exit. They don't do that with the teenagers. With the teenagers, they drive you around the block, have you do a 3-point turn, back up 30 feet, whatever. But for the adults, it's far more complicated because they expect you to be using the highway and managing more complicated aspects of driving. So just be prepared for a more rigorous driving assessment. The other thing I didn't put in a slide, and I'll mention, and we can always go back to this, if you don't pass that driving assessment, there is something called a restricted driver's license, and that's where a driving safety officer will come to your home and you will say, listen, I didn't pass the driving test getting on and off the highway and all the complicated things in the DMV neighborhood I didn't know about. That was confusing for me. I didn't pass. But if you say, I want the restricted driver's license, they come to your home. You say, listen, I need to go to my supermarket, my hairdresser, my pharmacy, my daughter's home, and they all live within 8 miles. This driving safety officer will go with you through this 8-mile location, A to B to C to D. If you pass that, because that's where you know how to go to and from your pharmacy, you know how to get to and from your daughter's house. If you pass that, that is your restricted license, and they will stamp that on the back of your license and say, okay, they're fine to drive in this neighborhood. Or they'll say, you live in a gated community, you're fine to drive in your gated community. That's it. It just depends. So I just want people to know there are options, and we can revisit this. It's a complicated topic. If you would like to work with someone on the road, a private on the road assessment, you would have to work with someone from the Association for Driving Rehabilitation Specialists. These assessments generally not covered by insurance. They can cost $500 to $800 for like a 2 or 3 hour assessment. A lot of them are occupational therapists, not all, but most. Here's an example of some of these CDRS, the Certified Driving Rehab, Certified Driving Rehab Specialist is their official certification. And there are also certified driving instructors. The CDRS is far more complicated to get. It's like over 3,000 hours of training in order to get the certification. So they're highly trained individuals, and they'll give you a written report. Sometimes they want the referral from the neurologist. They might try and bill insurance, but mostly it's just cash. So these are some local folks.
And Julie,
then,
why would somebody want to have one of those assessments?
The on the road one, because some people find that the clinic-based with the driving simulator, they don't feel like they were assessed accurately, or the computer visual assessments, we give the results, or they don't like the results of that. And so they feel like they just want to be assessed in their car. And I totally appreciate and understand that. So if you just feel like, I want to be assessed in my car, I want feedback of what I'm doing right and what I'm doing wrong in my car, then you would work with one of these individuals, because I can't show you that in the clinic. But the other thing is, if you just call the regular driving school, like we have lots of patients that call the local driving school, and you call the local driving school and they're less expensive. I think they're like $300, $350. And you say, I just want a refresher. My family tells me I'm hugging the right side of the road, or actually I'm riding on the double yellows, or I'm not braking fast enough, or I'm driving too slowly. I need a refresher. You can go to a regular driving school and just say, I'm a mature driver. I want to work with a mature driving instructor, and I'd like to just have a 1 hour practice or 2 1-hour practice lessons. They're very happy to do that. And if you just call a regular driving school, most likely they will have you drive in their vehicle because they have the instructor's brake on their side. But that's something you could talk about with the driving school. These individuals are more expensive and have this other extra certification. Say they may do extra assessments that an OT could do versus a driving instructor from a regular driving school.
And wouldn't a written assessment from one of these CDRS specialists, would a written assessment be valuable to anybody? Like, can you take it to your neurologist, or can you take it to the DMV? Does anybody care about that assessment?
Well, yeah, because sometimes you'll go to the DMV and let's say your license was suspended and you go to the DMV and you have the discussion with the driving safety officer. They can say, okay, the doctor's filled out the paperwork. It looks like you're on your Cinemat. It looks like you have worked with the OT in clinic. They can say, we require. So the DMV can say, we require that you work with a certified driving instructor, which is a CDI, which is also someone at a driving school, or they could say a certified driving rehab specialist. They could say either, we require that you work with one of these individuals and we require that they provide a report that they have assessed your actual skills on the road. And then once you do that and you bring your paperwork back to us, we will reissue your license. So that I've heard that option. I've heard that scenario as well. And so then this person who provides the report, you would bring it back to the DMV driving safety officer, and then they would reinstate or not. If you don't pass with the certified driving instructor and they say, I'm sorry, you're really not okay to drive. Like this is, unfortunately, driving is not safe for you anymore. Then that report that goes back to the DMV would, of course, be a full suspension.
Okay, thank you.
Yeah. And then that's it. My last slide is just just to know if ever you have to do anything to your vehicle, or let's say down the road, mobility is so difficult for you that it's safer for you to be transported in some type of a manual or a power chair or a scooter. And let's say that happens down the road and your family decides to purchase some type of a accessible van or car or truck. Just be sure, if this ever happens down the road, you work with one of the appropriate dealerships. It's not everyone can sell these appropriate vehicles, and you just want to make sure that they know what they're doing. And if you are getting some type of an accessible van, that it's working properly, and that you have dealers or technicians that could help you if something were to go wrong. So really, that was it. I think I jumped around a lot. I'm sure I answered some of your questions, but I'm sure you have many more questions.
Yes, I'm sure people do. So we invite anyone to enter their questions either into the chat box or the question and answer box. And one of the first questions I didn't entirely understand. It's Marshall's question. I understood the question, but I didn't quite get the context. But maybe Julie, you could take a stab at it. Marshall says, will you mention issues regarding getting an initial California driver's license with Parkinson's disease?
Yeah, so so let's say maybe you've just moved to California from another state, and now you're required to get a California driver's license. So you can just go to the DMV and you can fill out the paperwork and just go through the regular steps. So you don't necessarily have to take a driving test. So if let's say you come from Massachusetts, like when I came from Massachusetts to California, I went and I had to apply for my California driver's license, and I showed that I had a Massachusetts license. I paid the money, took the test, passed the visual, and that was it. Then I had my California driver's license. I was not required to retake the driving test in California, and you won't be required to do that either. If you walk in, you can just go through that. If, however, you have been contacted by the DMV, they want to talk with you first because somehow they had been alerted that you had a diagnosis with potential motor or cognitive impairments, then you'll have to go through the process I described where you meet with the driving safety officer, and then they'll say, okay, what's the situation? Here's the knowledge test you have to pass. Here's the actual on the road test. You have to pass that as well. Did that answer your question?
I hope so. Marshall, if it didn't answer the question, then please reply again in the chat or the question and answer. I had a couple more questions, Julie. One is, I think it was your very first slide mentioned the motor skills, and you were talking about not your car's motor, but your own neuromotor skills. And you mentioned as part of that range of motion issues in the neck and the trunk. I think there was another area. Are these range of motion issues, can we all expect to have some level of these range of motion issues as we age?
Yes, so it is part of aging. If you have issues with arthritis, then certainly your range of motion would be compromised and painful. There are some individuals as they're aging, they partake in yoga classes, they do regular stretching, they have massage therapists, they have personal trainers, they go see PT on a regular basis, and they maintain their stretching and they maintain the best range of motion they can. So it can diminish with age, but if you stay on top of it, then you will maintain a good and safe level of range of motion. And so, really it's the neck and trunk and shoulder. Those are the limitations I see, right? So you can't look back properly. So what happens is a lot of my patients start having diminished divided attention, which means the ability to focus on what's going on in front of them and the adjacent stimuli. And without that easy, quick range of motion to scan and to check and to look, I have a lot of cases like I got into a car accident in the parking lot. I clipped the bush. I didn't look. I hit the curb. And that's where I just want people, if you could really work on that range of motion, you could work on doing those extra checks, check all your mirrors. Hopefully you can avoid those types of situations. I tell folks, if you want to get in a couple extra steps, park actually farther away, park at a location in the parking lot that you're not at risk of knocking over those people who walk out of the Target looking into their cell phone and not paying attention. You won't have to deal with any of these people if you park farther away and then you do a little extra walking, get your steps in. So I don't know if that helped.
Okay, perfect. Marshall replied in our chat. He says, will the California DMV inquire about medical issues? He currently has an Oregon driver's license and is moving to California. Will the DMV ask as part of the new driver license application process, will they inquire, do you have Parkinson's disease?
Yeah, well, so let me see, in a renewal, when you get the renewal, I believe it's question 2, or it could be question 4, but it does say, do you have a medical condition that may affect your ability to drive? And that's in the renewal. I don't actually know for the initial driver's license. So, but yes, it may ask, because I know for sure that question is on the renewal. And the reason I know, because I talk about it a lot with my patients, because they will have, let's say within the 5-year renewal, they will have either had a stroke or they got diagnosed with Parkinson's, or they got a diagnosis of MS or a motor neuron disease or diabetes. And in that case, by law, you have to check the box yes, and then you would say, I have Parkinson's disease. So to answer Marshall's question, if that medical question is on the paperwork, just say yes, and then just write Parkinson's disease. They may or may not contact you. It's better to put it down. I'll tell you why. For my patients who renewed and they didn't say that they had had a stroke during their 5-year wait, If they get into a car accident and then that person wants to hire an attorney and they look into your records and say, wait a second, you had Parkinson's or you had a stroke. Why didn't you tell the DMV? They had the right to reassess you. And because you checked, no, I have no issues, then you're the one in trouble, even if it was the other guy's fault. So I say err on the side of caution. Just write down, yes, I have Parkinson's disease. If there's extra space, you can say, I'm under the care of a neurologist and therapist, if that's the truth, obviously, only if it's the truth. And then they may not even call you. Because I have patients who say, oh, I had a stroke in this year, currently independent under the care of a neurologist. They never even get a call. But you've put it down, so you're safe.
And to put a finer point on your example, we did have one person in our caregiver support group a few years ago who reported that her husband with Parkinson's disease had been in a car accident, had gotten a driver's license renewal, had not checked, yes, I have Parkinson's disease on that question. And his insurance company refused to pay for his part of the accident because the insurance company said you
lied on the form.
Yeah.
So that's why it's better to err on the side of caution. And again, if they call you in, you can say, I'm under the care of a neurologist. I'm taking medications. I'm under the, I work with therapy. And if they say, well, that's fine, we still want you to retake the knowledge test, we still want you to retake the driving test, then go ahead, do it. It's better to cross the T's and dot the I's than compromise your estate, because you don't want to get sued. That would be lousy.
Yeah, indeed. One other aspect of aging, at least I assume it's an aspect of aging that certainly plays into Parkinson's disease and driving, is sensory issues, particularly with regard to hearing. Hearing loss. There's an association between Parkinson's disease and hearing loss, and there can also be an association between hearing loss and cognitive issues. To what extent does the simulator that you showed yourself a picture of driving, to what extent is hearing evaluated as part of that?
We don't have a formal hearing assessment. I mean, what we do is we identify your ability to hear based on the conversation we have, based on so the simulator does have auditory commands. So if you're wearing your hearing aid and you are able to hear the auditory commands, then you would know to take the right or to take the left. And so that's the only aspect of the simulator that would officially assess hearing. But that also is not necessarily you didn't hear it. It could be your divided attention skills are diminished, where you are not able to do a task and hear things being stated at the same time. But I don't have the device that checks the high tones and low tones. Only just, commands called out by the simulator to take a right or take a left.
Right. Okay. Is there any things that people with Parkinson's disease and the rest of us who don't have Parkinson's disease, are there any things that we can do to maintain our driving skills so that well into the future, as long as possible?
Yeah, I would say, it's really helpful to just work with a driving school instructor, even if it's just a 1 hour lesson. Again, it's not covered by insurance and you can negotiate the price. But I think it's really helpful because, apart from families saying, well, I don't feel safe driving with you anymore, that's not helpful feedback. And it's hard for family members to, say, or maybe not, you're hugging the right or you're hugging the left or you're driving too slowly. So if you can work with an instructor, they will say, listen, you have to pick it up. You're not accelerating well enough onto the freeway, or why don't we just skip freeways altogether? Let's keep you driving. Let's keep you on the side roads. let's give you better visual cues on how to stay closer to the, to the midline. Let's work on working on more space between you and the driver in front of you, so that, if you are visually processing more slowly, you still have those extra few meters to come to a complete stop. Hey, let's review, don't take your medication and then expect to drive an hour later. Why don't we really talk about that process? Let's get you a vehicle where there are some other signals, like, the Tesla, it prevents you from driving over midline and prevents you from driving into a ditch. One thing it won't prevent you is if you fall asleep and you're the first person at the traffic intersection and you fall asleep and you roll into the intersection, it's not going to stop you. But if you do doze off and there's a car in front of you, it will prevent you from slamming into the vehicle in front of you. So, you can get vehicles with some of these alert systems. Be mindful of your medications. You can just adjust your practice by giving more space, driving during clear conditions to reduce traffic. You can park farther away from all the commotion because, knowing that your divided attention and some reaction skills will be slower, just park farther away. Like I said, getting the extra steps is good for you. Exercise is good for patients with Parkinson's.
Mhm.
So, these are definitely ways you can keep driving longer. And that is so helpful because it's an instrumental activity of daily living, right? It's your independence, and it's really important to engage in community, and it's meaningful occupation. So you want to stay driving as long as you can.
One thing that comes up a lot in our Parkinson's caregiver only support group meetings is that caregivers or other family members are very concerned about a person with PD driving.
Mhm.
And it might manifest itself in the idea that some adult children will say, Dad, I'm concerned about your driving. I'm not going to get in the car with you, and I'm not going to let you drive around my grandkids.
Yeah, I hear that all the
What
time.
can caregivers or family members do to raise these issues with a person with Parkinson's? And a follow-on question is, if the person with Parkinson's isn't receptive to any feedback like this, what can the family do?
Yeah, these are really, really good questions. And, we address these issues quite a bit in clinic, or I used to when I was in clinic. So I think it's helpful you can get a clinic-based evaluation to get some measures. So some measures that say, these numbers suggest you are really not safe to drive, or these numbers suggest you have amazing reaction times actually, but what you don't have are divided attention skills. That's a hazard. Let's work on this. Or, you can have other visual processing skills assessed. So I think it's helpful to get the numbers on the driving battery assessment, on the UFOV, on the pedal reaction test, the steering, like get some numbers to really identify where are you in with the normal limits, or are you not with the normal limits? That can help make the decision for you, right? And then, but in terms of if you don't want to do that, you can maybe compromise. If the family says, well, I don't want you driving the grandchildren, and you say, well, I really feel like I'm safe, say, okay, let's hire a driving instructor. So that's a compromise. Like, I will show you that I can do it. And then maybe family members will say, okay, I'd like to get that written report and actually have you on the road driving. So I think, maybe that's a nice compromise. If really there's a resistance to showing that you can do it, or there's a resistance to coming into clinic to show that you can do it, then, I don't know what to say. It's really, it's a really difficult conversation to have. It's difficult knowing if you think you're not going to pass the test, to agree to be tested, because you kind of feel
Could
like
you talk a little bit about anonymous reporting?
Yeah, you can. So that's a form that you can pull off the DMV website. And what you can do is you can write down the reasons why you're referring this individual to be contacted by a driving safety officer. So thank you for reminding me. That is another way that a family member or a neighbor, anyone, any person can report any person as long as you have their license plate. It's actually anonymous, not anonymous. You have to put your name, but they won't disclose it. And so it's kept confidential to the DMV, but not to the person who's contacted. But let's say you have someone in your neighborhood who drives 100 miles an hour down your road. As long as you have their license plate number, you can report that person. But so a family member could fill out the paperwork and check off one of the boxes identifying, a medical condition that they feel they're unsuitable. And then the DMV will contact the individual to come in, and they will be assessed and go through either the knowledge test or be referred for a driving test. So yeah, that's another route if they absolutely refuse to do one of the other assessments.
Yeah, and I would say just another anecdote from one of our Parkinson's caregiver support group meetings is we had a lady, I don't know if any of you on the call remember Roberta, but Roberta came to our support group meetings for many years, and her husband, she was very concerned about her husband's driving and mentioned it in front of the husband to the neurologist. I have concern about my husband's driving. And the neurologist sent the husband to Stanford for one of the simulator assessments.
Okay. Mm-hmm.
And he basically failed, but
Right.
he said he still wanted to try at the DMV. And so
Okay.
the DMV gave him a road test, and he failed. But the DMV said, if you want to come back in 4 months, you can try, take some driver's education, driver's instruction, take some training and come back. And he did that. And in 4 months, he went back and failed again. And the DMV said, one more time, we'll let you try it again in 4 months. And after that, he decided finally to give up. But the lesson for me was that that seemed that the system was very fair to him. He had many opportunities to demonstrate objectively that he could drive, and he simply couldn't. And so he basically, his license was taken away from him, but in as fair a possible way, if that makes any sense.
Yeah, no, yeah, for sure. I have had cases where they did not pass I had one individual who did not pass the clinic-based assessment in one aspect, and went to the DMV and was able to pass in their vehicle. So, it's like that one day in the clinic, maybe they didn't sleep well, or, they were nervous, or, they really just didn't jive with aspects of the driving simulator, which is totally possible. But most of the time, the data is really quite good and will give individuals a good understanding of where they could remediate skills. And if they're failing all of the different kinds of assessments that we offer, then chances are that driving is really not a safe option anymore.
Right.
And so we like to acknowledge what a loss it is, and we like to acknowledge whether there's ways to use driver-based apps or connect with other neighbors, or maybe now with more people being vaccinated, people can give each other rides, but it's really hard. So it's a challenge.
Yeah, it is. And that's a good segue into another question, which is, what are the alternatives to people if they don't have a driver's license and can't drive anymore? You mentioned apps, so
yeah. So there's there's Uber, Lyft, Go Grandpa, or Go Grandma. It's an app that's where like adult children could actually set if an individual doesn't have a smartphone or doesn't like using a smartphone or isn't particularly good operating apps or like the Lyft or the Uber or whatever, there's a I think it's GoGo Grandma, where a friend or an adult child could set the ride for you, and then they would pick you up and drop you off. And then there's lots of public transportation like Outreach, where you would just need your doctor to fill out the paperwork or sign your paperwork so that you could use the transportation for individuals with disabilities or whether it's physical or cognitive impairments, and they just need a window of time to pick you up and bring you to an appointment. And then same thing for the pickup. So I have many individuals who use all these systems in the community, VTA, Outreach, paratransit, and they get dropped off at clinic and we do our appointments, and then they go back to the lobby and then they wait for their pickup. So those are options too. If you need to get to and from appointments and things like that.
Yeah, I don't know if these courses are being offered now, but the AAA and I think the California Highway Patrol used to offer, at least pre-pandemic, safe driver courses. Do you recommend those courses? Can they be useful for people?
I don't know the details of the safe driver course apart from my understanding was that it would more talk about, driving, mature driving, and adjusting to your vehicle, making sure that your vehicle, like a car fit, is proper for you, so that if whether it's the steering wheel or the functions are too complicated, that you're actually using a vehicle that's appropriate for you, where you have good view, your big windows, proper alert systems. I don't know all the details of the course, but I know if you take some of these programs, your insurance, and you tell your insurance company, they'll give you a discount on your car insurance.
Yeah.
So it would suggest that you're staying on top of your car fit and your car safety, and so they like that.
Yeah, right. You've mentioned a couple of times divided attention skills. Can you say what that means, and if there's any rehabilitation possible for those kind of issues?
So divided attention, it's your ability to, like I said, focus on what's happening in front of you and to manage external stimuli and process that as well. So if you're driving on the road, but in your peripheral vision, you can see cyclists, or you're dividing your attention to other cars, that you are really aware of the other things going on. A divided attention skill is my ability to prepare dinner and listen to NPR in the background. And so if you are finding that you're having difficulties dividing your attention while to listening and doing a functional task, then sometimes we say, okay, maybe turn off the radio, or make sure whoever's in the vehicle with you is not talking. That's why if you're driving and there are grandchildren and they're chattering, that can be really distracting and not a good idea for someone who is showing impairments with divided attention. So to work on it, we have people do different activities on our big touch screens. But if you want to work on something at home, what you could do is try and prepare a meal and listen to like NPR, or put on a TED Talk. And so then at the end of the TED Talk, you could have 1 or 2 or 3 talking points while you're still doing a functional task, so that's what's important to work on. Have you ever, when you're trying to find a new location, you're driving to a new store and you have to turn down the radio, right?
Yeah,
that's divide. Yeah, you're driving, you're looking for the new store. There's one more stimuli. There's one more thing coming in, and you're like, I can't manage all this stimulus. So you turn off the radio. Okay, so that's an example where you are just able to process a lot at once. And so we find that skill is really compromised, and the visual the visual memory is quite compromised, which is pretty scary if you don't remember, seeing a car came into your view and then they're hiding in your blind spot. If you had no visual memory of them coming in and then that memory perished, and then you try and take a right because you didn't have good range of motion to check your blind spot, you can see how all these things can really snowball.
Yeah. Okay, well, I think, are there any more questions? I don't see any more from the chat or the question and answer. So, well, thank you very much, Julie, for all your time and good information.
Yeah.
Really appreciate it. And you've educated us all about driving in PD and some things I didn't know about, like the restricted driver's license. That's a really cool thing to know about, and that might be an ability for people.
Yeah, I like that. I like that option. So then at least you can maybe drive in your gated village or your 2 or 3 mile radius or your 5 mile radius.
Yeah, indeed.
Yeah.
Well, since we're using a webinar format, you can't hear everyone clapping, but I assure you,
Oh,
everyone is clapping for you, Julie. Thank you so much. We'll see you next time.
okay. Take care.
And to all of our group members, we have another meeting at the end of this month, which is, let's see, on Friday, June 25th at our same time at 2:30. And that meeting, we're having that meeting on a Friday because the speaker, who's a wonderful speaker talking about palliative care, he's not available at our regular time on Wednesdays. So we look forward to having a second meeting later this month, and we'll see you all then. Bye-bye.